We also found that households with children, immigrant and native, I should say immigrant, vary quite a lot by their use rates by country. Those that tend to have the highest use rates are, say, the Dominican Republic, Mexico and Guatemala, Ecuador. Those that tend to have the lowest use rates that we could identify are the United Kingdom, India, Canada, and Korea. Now, when we turn to try to distinguish legal from illegal immigrants, and we do this based on the characteristics of individuals in the household, there's kind of a whole cottage industry of trying to distinguish legal and illegal immigrants in the current population survey, also in the American Community Survey as well, and in the decennial census, or at least there used to be. The current census will not allow that kind of analysis anymore, but we find, or we estimate, that when we look at just legal households with children, households headed by a legal immigrant, we find that 52% used at least one major welfare program. When we focus on illegal immigrant households, it was 71%. So 52 for legal, 71% for illegal immigrant households. But there's a couple of important points that illegal immigrants generally receive benefits on behalf of their U.S.-born children. And it's also important to note that illegal immigrant households primarily, almost exclusively use the food assistance programs and have someone on Medicaid in the household. Their use of the cash assistance programs and the housing assistance is extremely low, virtually zero. Whereas among the legal immigrant population, they kind of use these programs at relatively high rates across the board. So if we look at the share of households using at least one program, we get a very, the illegals seem to be quite high, but it's very important to note that it's several specific programs. Again, the food assistance, food stamps, and a lot of WIC, and a lot of free school lunch. Now, welfare use by immigrant households is a complex question. I break it down in a lot of different ways in the report, but one of the important findings, though there are others, and this one isn't so surprising, is that it is the relatively high rate is partly explained by the relatively low educational attainment of immigrants in general. Looking at all immigrant households, if we look at those headed by someone who has not graduated high school, we find that 80% accessed at least one of the major welfare programs. If we looked at immigrants who had at least a college degree, it's 25%. Again, focusing on households with children. So very large differences by educational attainment. Now, it does not explain all the difference. In fact, a decent amount of it doesn't explain. But nonetheless, it's important to understand that welfare use rates among immigrants vary very much by educational attainment. An unwillingness to work is not the reason immigrant welfare use tend to be relatively high. The vast majority, 95% of immigrant households with children had at least one worker in 2009. But the relatively large share with low levels of educational attainment means that more than half of these working immigrant households with children still access the welfare system. So that's a very important point. People sometimes think that the welfare system is only for people who don't work, who sit on their couch. But that's not the way it's designed. There are a whole series, particularly of non-cash programs, and even some cash programs that go to people who also work. You can work full-time, but still live in public housing. You can work full-time, but your kids can still qualify for free school lunch. If you have a new child or are expecting, you can still get WIC. If you work full-time in many states, you can still sign yourself or your children up for Medicaid. That's how our system works. Work and welfare don't necessarily conflict. They often go together. And that's especially true since the '96 reforms, but it's always been the case. Now, although we focus on households, actually I should mention one other point. We don't find that the inclusion of refugees makes that much difference in the data. We try to take out the primary refugee sending countries and recalculate, but they're not a big enough share and their use rates are not dramatically different. So taking out the refugees doesn't seem to make much difference. I should also point out that if we look at all immigrant and all native households, those with children and those without children, put them together, we get a total of 37% using at least one major welfare program for the immigrant households and 22% for the native-born households. So as you can see, the households with children use higher rates, but when you look at all households, the gap between immigrants and natives doesn't really narrow in any meaningful way. So what does this tell us? Well, it's important to note that although most new legal immigrants are barred from using some welfare programs for the first 5 years, and illegal immigrants aren't supposed to use the programs at all, these provisions have only a modest impact on use rates because most immigrants have been in the United States for longer than 5 years. The ban only applies to some programs. Some states provide welfare to immigrants on their own. By becoming a citizen, immigrants become eligible for all welfare programs, and perhaps most important, the U.S.-born children, including those born to illegal immigrants, are automatically granted American citizenship and are therefore eligible for all programs right at birth. So maybe, what does this mean sort of for policy when we think about it? Well, the first thing to understand is, of course, that most immigrants come to the United States to work. In fact, immigrant households with children are somewhat more likely to have a worker in them than are native-born households with children. However, the relatively low education level of many immigrants means that a large majority of a large share, I should say, of working immigrant households still access the welfare system. In other words, they have low levels of educational attainment, and as a consequence, they tend to earn significantly lower wages on average, and that's what drives much of the results. Just to give you one statistic, about a third of immigrant households are headed by someone who has not graduated high school. For the native-born population, it's about a tenth. So somewhat over 3 times as likely to be headed by someone with the least level of education. But what does this mean? Well, it means one thing, I think, that when someone like President Bush says, look, when he thinks about the immigration issue, what he's thinking about is matching a willing worker with a willing employer. What these statistics suggest is that that's not all there is to think about. You still might favor his policy prescriptions, and they're very similar to President Obama's policy prescriptions. There's not much meaningful difference between what President Bush wants to do and wanted to do and what President Obama would like to do. There's a lot of agreement there. But what these data suggest is it's not just between the worker and the employer, that if you allow in lots of unskilled workers, it can create very significant costs for taxpayers. That individuals with relatively little education in the modern American economy are going to have relatively modest wages and thus qualify for social programs. So the discussion of what to do about this problem, assuming it is seen as a problem, should be conducted with a recognition of its complexity. On the one hand, it's not enough to say, well, we bar newly arrived legal immigrants. That does not reflect how the system actually works. I think it's also a bad idea to point out immigrants came in the past and didn't need welfare. I think that's not very helpful either, because these programs largely didn't exist. So I think it's a mistake, and I think there's a lot of people who do this, who think about immigrant welfare use as a kind of moral defect. And I think that is a terrible mistake. It does not capture what's happening. What's happening is most people come to work, most people work, but because of their education levels, a very large fraction use the welfare system specifically to support their children. When thinking about this issue, therefore, it makes more sense to acknowledge, it seems to me, that spending on welfare is part of every advanced industrial society, including our own. Moreover, we have to recognize the limited wages that less educated workers will earn. Our immigration system needs to reflect this reality, and if we're concerned about welfare use, what these numbers tell us is we need to select immigrants who aren't likely to need these programs. One of the best ways to do that is to select immigrants much more based on their education levels. Trying to bar the immigrants after they've arrived is not likely to work, It's also of questionable fairness because it says specifically to legal immigrants, you may come, but don't expect to be treated like one of us. And I think that's a troubling message as well. And the experience with the 96 welfare reform law suggests, specifically for the non-cash programs, that trying to bar people after they've arrived is not likely to be that effective. For all the reasons that I've touched on. The bar is only temporary. You can become a citizen and avoid it. The presence of citizen children. It seems to me we need to focus, if we're concerned about these issues, on the question of selecting immigrants who are unlikely to need the programs. Thank you.